As frustrated as it is, and many Democrats have shared your views here, the bottom line is that the current situation is not sustainable. The Republicans desperately need a legislative win here, and they seem to be doing whatever it takes to pass this vote. Do you just have to accept that?
Heavens no, we're fighting a tooth and nail because I have 750,000 of people that I work for whose health, the most precious asset we have of all our assets, is seriously jeopardized by this. You know, I think it's pretty amazing. It takes a lot of talent to take a terrible bill and make it worse. But I do believe that is what has happened here. The contortions that they have gone through, the machinations, the Machiavellian efforts to hide the ball from the American people, that's what's not sustainable, because this new provision is worse in some ways for those with pre-existing conditions. You would create conditions that actually would drive up with huge premium increases so that people with pre-existing conditions would not be able to find an affordable insurance. They've actually created incentives that make it worse for states to incentivize states to not cover people for Medicaid. And this camouflage about opioids, they've cut $800 billion out of Medicaid, jeopardizing the 600,000 people I have in Medicaid expansion, and then have a few shekels thrown on the pile to think that's going to solve the problem. That just won't do. And I want to give some credit to some of my Republican colleague governors who've called out senators on this and asked them not to do grievous harm to either states led by Republican or Democratic governors. And those voices, I think, are going to be heard ultimately in this matter.
Governor Inslee, one theory of conservative health care reform is that, yes, you can push people off of Medicaid if you subsidize them for purchases in the individual market on their own. In theory, if enough money were allocated to subsidies for people who lost Medicaid, if in theory there were enough money for subsidies for them, would that be a reasonable approach going forward?
It's not anywhere in reality because the Republicans will never do that. And the reason is that the primary driving, motivating factor here is not health care, it's wealth care. Their desire is to free up money from the federal budget that at some point will be available for huge tax cuts benefiting the wealthy at some point. Now, whether that's in this bill or their subsequent bill, doing a bait and switch isn't going to ever put money into that private insurance market, because their whole goal is to really decrease federal support for people's health care.